So tonight I'll just go through briefly what cancer is, the most common causes of cancer and the risk factors for it, how cancer can be prevented, and how we look for or screen for cancer. As well, I'll touch on a little bit of the risks of screening because every test has a risk, and the signs and symptoms of cancer. By the end of the talk, you might feel like this: stop smoking, quit drinking, eat less, exercise more, or use some kind of health nut. I think that's what my patients think every day when they come to see me. So cancer, and this is really any kind of cancer, it could be in the brain, prostate, lung, breast, is really a disease in which cells become abnormal and start to divide without control, forming a mass called a tumor. And they start to divide and become abnormal because they've had some sort of change to them. And that can be through a chemical or a contaminant, or it can be through things like ultraviolet radiation or light. It can be due to many different things, and genetic factors can play a role here as well. There are more than 200 types of cancer. Certainly we focus on the main types of cancer commonly, but there are quite a huge number of them, and there's no single screening test or diagnostic test for them. So that's why, certainly when people come in, they want a blood test to say that they're fine, but there's no one blood test that can do that, ultimately. In Canada today, there are over 470 Canadians diagnosed each day with cancer. In Ontario, someone is diagnosed with cancer every 8 minutes, which is a rather staggering statistic. 1 in 4 are expected to die from it. Now, that being said, cancer is becoming more of a chronic disease, and more people are surviving with cancer, which is the optimistic part. For women, the leading causes are breast cancer, lung cancer, which is the leading cause of death in women, and colorectal cancer. For men, prostate cancer, lung, which is the leading cause of death in men, and colorectal are the top 3 causes of cancer. As far as the risk factors for cancer, I think the main point I'd like to make is that most people have no known increased risk for cancer. They're just average risk, you and I, without any particular strong family history of cancer. And typically, these are the people that will get cancer. There's a smaller group of people, usually less than 20%, that have a family history of cancer. It could be quite a significant family history of cancer with many people in their family with different kinds of cancer that are associated on a gene, or it could just be sporadic family history of cancer. So your mother with colon cancer at the age of 60, but no other family history. That still does increase your risk of cancer. There are some rare hereditary syndromes which do increase your risk, such as people who tend to have a lot of polyps in their colon, and they would be more prone to developing cancer. And those people are usually identified and sent to genetics counselors to talk about their increased risk of cancer and what they should do for that. Other predisposing factors include chronic illnesses like colitis or inflammatory bowel disease, which increase your risk of colorectal cancer. And those people, people with a strong family history, are typically screened at a higher rate than the average risk person, because we know they're very predisposed to developing cancer. This is a very busy graph, but it just stresses that tobacco and things like diet, obesity, and physical activity do play a huge role in the causes of cancer. Other things like the environment, family history, effects around birth, alcohol, those play a smaller role but still significant, including sunlight, alcohol, all those things. There's also a huge factor of unknown. There's still a lot we don't know about this area. So almost 50% of cancers are associated with smoking, alcohol overuse, poor diet, obesity, and inactivity. And how are we doing in Northwestern Ontario? We do know that we smoke more than everyone else in Ontario in general. We do drink a bit more alcohol. We eat less fruits and vegetables a day. We tend to be less physically, we're pretty much on par with the rest of Ontario as far as being physically inactive, but that's not saying much for the rest of Ontario. And in fact, today I read an article in the Globe that was looking at recent statistics about how poor Canadians are for physical activity on a daily basis. It's quite significant. We are heavier in general than the rest of Ontario. So this alone shows that we have an increased risk of not only cancer, but multiple health issues. As far as tobacco use, we know that adult smokers lose an average of 13 years of life due to their addiction, and it's responsible for approximately 30% of all cancer-related deaths in the United States. The way it does this is it actually brings carcinogens directly to the tissues, causing irritation and inflammation, and this interferes with the body's natural protective barriers. This applies to cigarette smoking, cigar, pipe, smokeless tobacco, and secondhand tobacco smoke as well. This is a busy slide, but it does cause leukemia, as well as cancers of the head and neck, esophagus, pancreas, liver, stomach, cervix, kidney, large bowel, bladder, and lung. And in Canada, it accounts for approximately 85% of lung cancer cases. There's some evidence even tying smoking to more aggressive prostate cancers. And we do know that when people quit, even if they've been long-time users, they actually get immediate health benefits right after quitting. So if you are a smoker, or if you know a smoker, it's a good idea to assess how motivated they are to quit and look at what their reasons might be for quitting. Sometimes it's financial, sometimes it's health, sometimes it's pressure from other people around them, and what people's barriers are to quitting. A lot of people think that they'll eat more, or suddenly, I'm not sure. I think gaining weight is one of the biggest ones, but I think they also associate it, they have a relationship with smoking and they enjoy having a break from other things like work and that sort of thing. There are great resources out there right now. One is the Thunder Bay District Health Unit, which has great information about quitting smoking, and the Smokers Helpline. Alcohol does increase the risk of cancer, particularly cancers of the breast, mouth and throat, esophagus, rectum, and liver. And as little as 1 drink per day has been associated with an increase in cancer risk. They say that, when you drink 1 drink a day of alcohol of any type, that it's basically increasing your cancer risk by 6%, that 1 drink. It's hard to believe. I know there's a trade-off there. Sometimes you can help your heart if you're drinking, a modest amount, but that benefit seems to be offset by this risk with cancer. And this is a poor picture, but I wanted to remind people of really what a standard drink is, because sometimes it's easy to forget. Wine is actually 5 ounces, which is a fairly small portion of wine. And this is equal to 1.5 ounces of hard liquor, and a beer, a 12-ounce beer. So I know a lot of my patients, in the summertime when they're mowing the lawn, they sort of equate having a few beer with water or pop. And that's not actually true. So it does increase your risk. The recommendations or guidelines are that women can have up to 9 standard drinks a week, and men 14 standard drinks in a week. Some good things to follow would be that if you drink, try to stop before you get drunk, or wait at least an hour between drinks, and never drink on an empty stomach, as well as trying to make every other drink a non-alcoholic one. Never drink and drive, and don't mix alcohol with other drugs. This website here, the Center for Addiction and Mental Health, has excellent resources about alcohol, including trying to assess whether you're drinking or someone you care about, whether it could be a problem. Obesity, we do know that excess weight and obesity increases the risk of cancer, and these are the kinds of cancer it's been most commonly linked with, such as breast, colorectal, cancer of the uterus, kidney cancer, esophagus, and possibly even thyroid, pancreas, and non-Hodgkin's lymphoma. It also increases the likelihood of dying from some cancers. So you can find out from your doctor or primary care provider how your weight measures up by looking at your BMI, which is your weight over your height squared. And that can be helpful to see what you're at risk for in terms of health in general. Go ahead.
Cancer can hit you in so many places. You wait till it hits you first before you go to the doctor and say you want this test. I guess there's no other way.
It can feel like there's no other way to to look for cancer. But I guess one of the things I'd like to reinforce tonight is that by doing some preventative things, you know, firstly you can prevent cancer, but also you may be able to recognize some early signs of cancer as well and go to your doctor earlier rather than later. Some people do wait too long before they go. And the other thing is going in for screening tests when they're appropriate. Because sometimes, you know, people are a certain age and they don't come in at all, right? And we could catch it early before it becomes a problem. So thanks for your question.
I know with my doctor, sometimes they tell me I want to test for this or that, and say, it's not your genes, don't go there.
Yeah.
I guess it's costly, so don't go there.
Yeah. Yeah, I mean, having a discussion with your doctor over what tests might be appropriate and asking questions, because we don't always have all the answers. I know it's shocking. My children have already identified that with me. So I put in a little cartoon about employee wellness. You know, just we're having a big meeting today to kick off our employee wellness campaign. Did anyone remember to bring in soda and donuts? Because often when we're doing workplace things, I'm amazed that there is fruit here tonight, because a lot of times, you know, they're not with these sort of talks, but other cancer-related talks I've been to, there are, you know, croissants and higher fat drinks and foods, and we don't often link our action with what we're talking about. So for diet, meat, a high intake of red meat, processed meat, grilled meat has been associated with an increased risk of cancer. They think that with grilled meat, the chemicals that are produced by heating meat at higher temperatures, it does increase your risk of cancer. Fruits and vegetables, we would love to say that, you know, eating a ton of fruits and vegetables significantly decreases your risk, but so far it's only been shown to modestly improve, you know, your I guess, lower your risk of developing cancer. Certainly it is helpful for a variety of other illnesses as well, however. And with dietary fat, we know that excess calories leads to weight gain and an increased risk of multiple cancers. There's a link with diet high in animal fat, and interestingly enough, calcium as far as prostate cancer. So they have shown that if you're taking a significant amount of calcium, usually over 2 grams a day in diet and supplement, that can increase your risk of prostate cancer. So it is a balance with that. And there is a link with lower cholesterol and decreased risk of prostate cancer.
I don't barbecue too much, would that be?
Barbecuing too much could increase your risk of cancer, particularly something like colon cancer. Yeah. Now I put in a picture of McDonald's more to touch on the fact that we have been supersizing a lot over the last, you know, decade plus, and that's not necessarily a benefit. You know, it may be we may get more for our money, but that's not necessarily a benefit health-wise. And this is what a lot of families are growing up with these days, which increases their risk of problems down the road. This is the Canada Food Guide, and is a reminder of what actually one serving is, which you know, I found surprising the first time I looked at it, to see that serving of pasta is actually half a cup of cooked pasta. And that's a pretty small portion. I'm not too sure that I follow that too closely, but you know, it would be better if we did. You know, I think we can all agree. And often when we go out to dinner, we don't get that sort of portion. Meat should be the size of the palm of your hand. And when you look at this, it's actually not too overwhelming to get the amount of fruits and vegetables we should get, because it's only actually half a cup of a fresh, frozen, or canned vegetable. That's one serving. So you think of a large apple, that's actually two servings. Now, we've all looked for the magic vitamin and nutrient that could potentially prevent everything: heart disease, cancer, osteoporosis, dementia. But there's not that much evidence around cancer prevention with specific vitamins, and certainly some have been studied. It's challenging because you have to study these things over a long period of time, and you know, there's not a lot of money in vitamins, so it hasn't been as well studied perhaps as other things. We do know that vitamin D may reduce the risk of colorectal and prostate cancer, and it has been shown to decrease the risk of recurrence of colon and breast cancer, which is exciting news. Calcium increased intake has been linked with a reduced risk of colorectal cancer, and it does prevent polyps in the colon. They say a minimum level of around 700 milligrams per day, either through diet or supplementation. But there is this balance, as I mentioned, with too much calcium, we know can be linked to heart disease or increased risk of prostate cancer potentially. So the thing with certain vitamins and nutrients is that you want to make sure you're not getting too much of one thing. And typically a healthy diet can give you what you need. Folic acid in diet present in green leafy vegetables, fruits, cereals and grains, nuts and meats has been associated with a decreased risk of colon and breast cancer, especially in women who drink alcohol. But notice that this is in diet, so not specifically supplement. And multivitamins have been studied to some extent and have not been shown to reduce the risk of dying from cancer or developing cancer. Threw in a little bit about sun protection because sometimes we forget about that a little bit, particularly in the winter. The development of skin cancer depends on your total lifetime exposure to the sun, as well as repeated intense exposure, leading to blistering, burns, as well as other risk factors. So if you're certain skin types, you're more prone to it. If you're on certain medications or have a certain family history. But there are approximately 5,000 new cases of melanoma, which is the more serious form of skin cancer in Canada each year, with close to 1,000 related deaths. And this does include, sun protection does include avoiding tanning beds. I do see quite a number of young women in particular who do still use tanning beds, and I think more education needs to be done around that. We sort of want to stay away from this. So for physical activity, it has clearly been shown that physical activity does decrease the risk for colorectal and breast cancer, liver, pancreas, and stomach cancer, and possibly even cancer of the uterus and prostate. It's been shown across levels of obesity, so if you're 300 pounds and you exercise versus 150 pounds and exercising, you still will get some benefit. You don't have to be the ideal body weight, the benefit from it. The thing we don't know are the exact details of how long, how hard, how often to protect against cancer. The current recommendations are pretty much at least 5 days a week for 30 minutes. Often I see people who say, well, I'm doing this 2 days a week or 3 days a week. That's probably not enough. Really, most days of the week you should be active. That could be broken up into 15-minute intervals that day. It could be a variety of things, including gardening, lawn mowing, shoveling snow, whatever. But one way of assessing where you are is to take a pedometer, and which is $20 or $25, and clip it on you, and they say 10,000 steps a day is where you want to be considered active. So it's a good way of seeing, where am I? Do I need to increase my activity? I realized at work that I don't move around as much as I thought I did by using a pedometer, and it's a good gauge because sometimes you have a sense that you're moving a lot more than you are. We know that physical activity does help prevent the recurrence of cancer, such as breast cancer. This has been well studied, and it's certainly a great incentive for those exercise programs that are going on for cancer survivors. Now, I haven't resorted to this yet, though my dog probably would like it if I did. But we've certainly come to a time in our society where we want to multitask as much as possible, and I think we need to take a step back and maybe see how we can actually do physical activity in a way that's truly beneficial.
You have that dog on rollerblades.
Yeah, the dog on rollerblades, that's a really good idea. I put in a picture of two of my children, and these are the girls when they were on the same team playing hockey. And the point I want to make is that, these sort of habits start when you're young. And, we have a huge epidemic now with obesity in North America, not to mention childhood obesity. And really it goes back to who is responsible for that. I don't think children are responsible for, not being active. I think it's very natural for them to be active. So looking at the TV, the computer, the video games, trying to get kids outside. They don't have to be involved in organized sports, but free play and really watching what they, less fast food, smaller portions, better food choices. So secondary prevention is screening, basically. So that's what I do most of the time, day to day, and that's detecting early disease where there are no symptoms or when treatment can stop it from progressing, such as pap testing or using mammograms or fecal occult blood testing. So that's pretty much my day-to-day job. There are lots of reasons why people don't participate in screening, everything from I feel fine, I'm healthy, tests are painful, messy, I don't want it done, they don't have the confidence that they can do it or that the test will actually do what it's supposed to do. They're anxious about the consequences. This is likely a huge number of people. And they really don't have enough information. Now, why do we screen for some cancers and not for others? I'm asked this quite regularly by my own patients. Part of the reason is that we screen for cancers where there's good evidence to screen for them, so we know that are safe and effective treatments available, and there's a known phase where the cancer is not yet a cancer, or where we know we can catch the cancer early. And also, something like breast screening, we know that it's cost effective to do on a large scale. So if we were going to CAT scan everybody's lungs to look for lung cancer, when we know that that hasn't been proven to actually help, that wouldn't be very cost effective. And we also need to know that the benefits outweigh the harms of screening. So I will touch a bit on specific kinds of cancer, and I'll talk briefly about cervical cancer, of which 420 women in Canada die per year, according to the latest statistics. And we do recommend pap testing within 3 years of sexual activity, and then yearly for 3 years, and then every 2 to 3 years until the age of 69. So it does continue until you're older, but can stop if you've been adequately screened. We know that 38% of cervical cancers occur in women who've not been screened in the past 10 years. So that's quite a high number. It's very preventable. If you show up for your pap testing, usually you should not have a problem at all. For younger girls, ages 9 to 26, they can consider the HPV vaccine, which is a newer vaccine for cervical cancer prevention in that age group, and also not smoking will reduce the risk. And you do not need a PAP if you've had a hysterectomy or your uterus out for harmless, non-cancer reasons. This is just a brief schematic which shows you that the area that's actually being tested is the opening to the uterus. It doesn't go in the uterus. It's very limited to this area, but that's what a lot of women don't really understand, exactly what area is being tested. The Colon CancerCheck program is an exciting program from my perspective that started in April of 2008 in Ontario, which was the first population-based screening program for colorectal cancer. What it did was provide average risk individuals with fecal occult blood testing every 2 years to screen for colorectal cancer, and increased risk individuals due to family history were sent for colonoscopy. And this is basically why, and part of why we screen for colorectal cancer versus some other cancers, and that's because we get a progression over 10 to 15 years of changes from normal lining of the bowel to a polyp. And so what happens is you get minor changes, and then over that period of time, the polyp may be there, but the polyp becomes more and more abnormal with time. And so it does take that 10 or 15 years often to develop a polyp, and about 2/3 of polyps can become cancer. There are a third that don't, and don't have a higher risk of becoming cancer. And that's why we try to screen for it, so we can catch it before it's a big problem.
What age group did that start?
Typically over 50, unless you have a family history of it. Yeah. And this shows why it's after 50, and that's because the occurrence of colorectal cancer, quickly increases after the age of 50. There are a few cases before, but not as much as after 50. This is what the fecal occult blood test looks like. Hopefully some of you recognize it. And this is a schematic of the bowel and what would happen during flexible sigmoidoscopy or colonoscopy. You have to remember that the bowel is 5 feet long, with the rectum being 6 inches, so it is quite a long space. And basically, when you're getting a scope, there's a flexible light being put in, and for a colonoscopy, They do try to get all the way around, which is quite technically difficult. With a flexible sigmoidoscopy, which is another way to screen, they only go up this last part of your bowel here, but that is where most cancers can occur. For breast cancer screening, we do focus on breast awareness rather than self-breast exam, so having women be a little bit aware of any changes, a new rash or discharge or lump. And we encourage women to go yearly to their physician, particularly over the age of 50 for a clinical breast examination, but this can start, when you go in for your PAPs as well. Mammogram screening should start at the age of 50 and occur every 2 years unless you have a strong family history of breast cancer. And we're very fortunate in Ontario to have the population-based program, the Ontario Breast Screening Program, which many of you have likely seen the bus and the van that drives around northwestern Ontario and provides a spot for women to get mammograms. Just a little cartoon. I don't think it's quite that bad. For prostate screening, I included this, even though it's not one that we typically include as having a huge amount of evidence around it. Certainly it's one that men talk about quite a bit, so I included it. It is routinely done with the blood test, the prostate specific antigen or PSA, and digital rectal exam. And we know we've had a few randomized trials that have showed that the evidence isn't there yet to support routinely doing it on every man over 50. Because what happens is you tend to get overdiagnosis and overtreatment, which can cause significant problems for men. So the important thing to do is to discuss, individually with your physician, what your risks would be, what your concerns are, perhaps have an exam and go from there. We do typically stop screening if a man has been screened at the age of 75, because to find a very early cancer at that point, after the age of 75, would usually put a man in, make him have too much harm from surgery and side effects from treatment to give him any benefit at that point.
If you already had the prostate cancer, should you have the PSA the rest of your life every year to see?
Once you've had prostate cancer, you do need the PSA to monitor it.
Every year you should have.
Yeah. Well, sometimes they monitor it even more often, depending on how aggressive the cancer is. Yeah. So for ovarian cancer screening, this is something I get asked about a lot. A lot of women would like to be screened for it. It is the 7th leading cause of cancer death in women worldwide, and most ovarian cancers have spread by the time they're diagnosed. The strongest known risk factor is family history. But there's no evidence to date that screening actually helps women live longer with it. Currently there are 3 large trials going on, and we're hoping to have more information over the next few years. We know that potential risks are unnecessary surgery due to false positive tests, such as something on an ultrasound that was followed up with surgery that turned out to not be a cancer, adverse psychological impact, and cost. So the bottom line is we don't recommend screening average risk women for ovarian cancer. If there is a family history, then usually the woman will talk to their physician or primary care provider, and they'll talk about either ultrasound or a blood test, or a combination of both. For lung cancer screening, we know that this is the leading cause of cancer-related death. It's very common, very horrible to see. You've probably known people who've had lung cancer, and they do think that really the key is to prevent lung cancer, mainly through tobacco cessation. This likely will have a greater impact than screening. They've tried to look at many different ways of how to catch lung cancer early, including doing regular chest x-rays, CT scans, coughing up sputum and testing that, but nothing has yet been found to be successful. So they don't recommend screening people that aren't having symptoms. Recently, a trial was released that looked at using screening CAT scans of the lung in high-risk people, and that may have some benefit, and they're hoping to investigate that further. So that would be people with a really significant smoking history.
I'm going to ask another question.
Yep.
If you had some kind of cancer, would any of these herbal remedies do anything, I'm wondering?
Would any herbal remedies help with cancer? Well, that's a fairly general question. I can't, I don't think that there's any one herbal remedy that's been shown to help significantly. But it would probably depend on the kind of cancer, the stage, and what other treatment you're getting. But it is best if anyone is taking an herbal remedy to really talk to your oncologist and make sure they're aware of it, because a lot of times we don't know what people are taking. Yeah. And to talk to your pharmacist as well if you're on any other medication. That's important too. So the risks of screening, we know that not all screening tests are helpful, and they all do have risks to them. You really should discuss it with your primary care provider. I know a lot of times we hand out things fairly quickly in the office, and we may not give enough communication around it. But if you have any hesitation or questions around it, just ask. And that's more important than not doing the test because you weren't sure what to do or what it was doing for you. It's important to know the risks of the test and whether it's been proven to reduce the risk of dying from cancer. Sometimes we do tests that really don't have a huge impact that way. False negative test results can occur, so the results may look normal, even though there's still a cancer there. And I've diagnosed 2 men with prostate cancer who had a normal PSA, but an abnormal exam. So sometimes men don't want the exam, but the reality is that it's a combination. One test isn't everything. So sometimes when there's a negative test, for instance, if you have a normal mammogram or a PSA, that may delay you seeking help if you need it, because you're reassured by that test. As well, false positive test results can occur, and we see this quite commonly with mammogram screening, particularly in younger women who get screened. So women between the ages of 40 and 50 who get screened tend to have more false positive test results because the breasts are thicker than they are after menopause. So tests can appear to be abnormal even though no cancer is present, which leads to anxiety and is usually followed by more testing, so biopsies, further x-rays. Many of my patients say this to me: if you hadn't done those tests to find out what's wrong with me, I'd still be healthy. So that's the trouble, when you measure someone's blood pressure. They feel well, but what you get back may be abnormal. But that can be good in terms of catching it early before there are any other problems. So as far as the signs and symptoms of cancer, most of these, are common sense, but it's helpful often to remind ourselves to go in if you're having any of these problems. Significant unintentional weight loss, loss of appetite, fatigue, pain, skin changes, sores that do not heal, a change in bowel movement. So if you tend to be constipated and suddenly you're having, regular bowel movement, that would be a change. Low blood levels or anemia, thickening or a lump in the breast or other part of the body, indigestion or trouble swallowing, a nagging cough or hoarseness, unusual bleeding or discharge. And if you have any of these, speak to a doctor or nurse practitioner. This is a schematic of colorectal cancer and where it is when we catch it even before it's a cancer, to stage 1 through stage 4 cancer, where it actually spreads through the bowel wall and to other parts of the body. And our hope with prevention and screening really is truly to prevent it from happening at all, but catch it early if it does occur.
What kind of symptoms do you have if you have thyroid trouble?
The thyroid?
Yeah, if you have thyroid trouble. I'm not saying it's going to be cancer, but if it was cancer, what kind of trouble would you have? Trouble swallowing?
If you had thyroid cancer, would you have trouble swallowing? You could, but the thyroid would have to get fairly big to cause trouble swallowing. With trouble swallowing, I think you'd worry a bit more about a cancer in the throat. Yeah. Usually, if you can't see any lumps, but certainly if you had a big lump in your neck, you'd want to get it checked. Yeah. And some people do put off getting things checked because they're scared, right? So in summary, avoid tobacco or make attempts to quit. be physically active, maintain a healthy weight, eat a diet rich in fruits and vegetables, whole grains, and low in saturated trans fat, which is sort of similar to the Mediterranean diet, if anyone's interested in looking at that. Limit alcohol, get regular screening, and understand your risk. Use sunscreen as well. So in summary as well, making these small changes can make a difference, and you can encourage the people around you with the changes that you make, such as your friends, family, at the workplace. Making these changes decreases your risk not only of multiple cancers, but also decreases your risk of heart disease, osteoporosis, stroke, high blood pressure, high cholesterol, dementia, chronic lung disease, etc., etc. So it really, even though the focus is on cancer, it really is about being healthy and reducing your risk of multiple illnesses. Diabetes, very common problem. These are some internet resources which are wonderful, including Colon CancerCheck, Thunder Bay District Health Unit, Eat Right Ontario, Health Canada, Smokers Helpline. The BC Cancer Agency has a personal risk assessment tool, which we will hopefully be developing in Ontario as well. Dietitians.ca and Cancer Care Ontario. And we all have our reasons to stay healthy. These are 3 of mine, my children. So they motivate me sometimes to, go out for a walk or maybe put down the chocolate. Or they grab the chocolate out of my hands for me. And in the end, the bottom line really is just do it.